Good afternoon, Mr. Akana. I've got to discuss with you your new medication that the doctor put you on. He put you on digoxin at a 0.25 milligram per day dose. This medicine's for your atrial fibrillation. It's a cardiac glycoside, which means it leaves more calcium available for your heart muscles to contract a little bit harder. So it's going to increase your cardiac output while lowering your heart rate, because it helps your heart work more efficiently where it doesn't have to beat as fast to provide you with the blood flow that you need. One thing you need to know about digoxin, though, is that there's a very narrow therapeutic window. You only need your serum levels to be 0.5 to 2 nanograms per milliliter, so it's going to have to be checked very frequently to keep you in that range. Before taking your daily dose, you need to check your radial pulse for a full minute, and if it varies by less than or greater to 15 beats, you do not need to take the medicine that day, and you need to contact your healthcare provider. There's several adverse effects that could happen from this medication that you need to be aware of. You need to report immediately if you start having some shortness of breath or persistent cough. It would be wise for you to watch your weight daily to see if it fluctuates by 2 pounds or more. If it goes up or down by at least 2 pounds, that means you're retaining or losing fluid, and that could be a problem. You also need to monitor edema in your legs and ankles and your fingers and stuff, for your face. Some other adverse effects that you should really watch out for is if dysrhythmias or an AV block. They can be very detrimental. More common ones are going to possibly be having some headaches or some confusion. You might be a little dizzy, or if you start feeling like your vision's blurred or you're seeing some yellow-green halos around lights and stuff, that could mean that you're getting into a little bit of the toxic range, and we might need to check your DIG level. Nausea, vomiting, and loss of appetite are also symptoms you need to look out for. Some other things that you should be aware of is that you do not need to stop this medication abruptly. Do not double doses. If you have to miss one, take it within 12 hours of the original time. And do not take antacids within 2 hours of taking this medication, because an antacid is going to decrease the absorption. All right. If there's anything else that you need help with, just let us know.